Hello everybody, my name is Dr. Tamisha Denis of Modern Smile and Implant Center, and today we're going to talk about jaw shrinking. I don't think anybody really uses that term, jaw shrinking. However, if you have worn a denture, you know what that means. That means that over the years of you wearing your denture, ever so often you feel like that denture doesn't fit so well anymore. You might go to the dentist, have the denture relined. That means they put more material in the inside of the denture, and then it fits good for a while, and then it doesn't again. But why does that happen? That's something that we're going to discuss, and I will show you with a demonstration model exactly the reason that that happens. First, let's talk about why does the bone change after you have your teeth taken out. Whether you have one tooth taken out or all of your teeth on the top, all of your teeth on the bottom, or all of your teeth in your mouth, period, as soon as you have a tooth taken out, your jaw is going to change. The bone in your mouth is going to change. The way the body works with teeth, there's two kinds of bone. There's the bone that's your actual jaw. If you've ever heard this word, it's the maxilla, which is the top jaw, and the mandibular or the mandible, which is the bottom jaw. Now, that's one kind of bone, another kind of bone, and another kind of bone is called alveolar bone. And alveolar bone just means the bone that holds the teeth in place. Now, once you have a tooth taken out, like I said, whether it's one or many, as soon as that tooth is taken out, the body says, I don't need that bone anymore, and it starts to shrink. So if you've ever had a tooth taken out, you'll see that the bone and everything is kind of lumpy at the beginning, and little by little it gets smoother and smoother. And if you really pay attention to the inside of your mouth, you'll notice that the bone that was once really wide will get narrower and narrower and narrower until it's kind of almost like a triangular slit. Now, you have to imagine if you're wearing a denture and your bone was really fat and now your bone is shrinking, that denture is going to move a lot more. So as soon as those teeth are taken out, the bone is going to change. Now, all of that sounds really great, but let's see what that really means. Now, most people don't get to see themselves in this kind of way, but I'm going to show you. Let's start with the upper jaw. So this is a model that I have here, and it's going to show you kind of the upper jaw and how it changes over time. So let's start here at the bottom, and I'm going to try to show it to you in different angles so you can get it. So, well, actually, let's start at the top. If you look here, this is someone with their full set of teeth. The bone is nice and thick and fat. And if you can notice, there's teeth on there, nice, big, fat, and tall. I think this is a better angle to start at. So if you see nice and tall, big, bone, teeth all the way around. Now, you'll notice if teeth are taken out, you can see the jaw is still kind of fat, nice thick rim around there. Now, if you make a denture at this point, you usually can get a pretty good fit. And even though it fits really snugly, most people don't even have to use glue or denture adhesive, but it's not going to last forever because as time goes by, the bone is going to change. So let's look here, a lot thinner, a lot more slit kind of sensation here. Now, if you look here, it gets even thinner. Now, even though I'm showing you the model, let's show you in different aspects. Like I said here, the biggest one down to the bottom till we get to the smallest one. Again, you can kind of see how it changes and gets thinner and thinner, right? So even though I'm showing you the top, most people don't have much trouble with the top denture. That's a denture that usually can maintain bone pretty thick for a very long time. So a lot of people, they'll wear their upper denture with no problem without needing denture or glue for many, many years. I've seen people with 20, 30, 40 years of denture. After a while, they do start to feel that movement, but the bone getting smaller takes a lot more time on the top. Now let's talk about the mandible. Now the mandible is a lot different. A totally different scenario, and this is where dental implants come into place a lot when we're talking about dentures. So let's look at the top one. Top one, teeth are nice and thick. The jaw is very big, very thick. You can kind of see how robust it is, right? Now, as time goes, let's look at the next one. That's a lot thinner, a lot more skinny from here to here. Then you look at this one. Ooh, we're starting to get that old look. That look where you see the chin kind of jutting out and kind of small. And then even more here. Oh, I've seen these a lot, right? So now let's imagine a denture on top of this. If you take your teeth out, so you have no teeth anymore, now you're here with no teeth, you make a denture, you're going to get an okay fit. And the reason I say okay fit, even with the best bone on the bottom jaw, on the mandible, even the best bone on the bottom, your tongue is constantly pushing that denture out, and you don't have the roof of your mouth to support the denture. So a lot of times, even the best fitting denture by the best made dentist doesn't quite feel so good, because it's a different kind of feeling with the bottom jaw versus the top. Now, already we have the chips stacked against us. Imagine now we have bone that's getting smaller and smaller. Remember, we have no teeth, so the body doesn't feel a need to maintain that bone right here. So it's getting smaller and smaller, and you still have the tongue flipping everything out. So if you can imagine, it makes it really much harder to keep that denture into place. So that's why dental implants are so important, especially on the bottom jaw, because even with good bone, and imagine with not good bone, that denture is constantly getting flipped out of your mouth. It makes it difficult to eat food. So dental implants are a game changer when we're talking about a lower denture, because now you can have not even great bone, but a great fitting denture. So now that you've seen the different jaws and how the jaw shrinks over time, what does dental implants do for a denture? What does dental implants do for your jaw? So what it does is it tricks your body into thinking you still have teeth. Yeah, it tricks your body into still thinking you have teeth. So now the body wants to maintain the bone around the implant because it still thinks there's a reason to have bone there. So whether or not you're getting implants to replace one tooth, or whether you're getting implants to replace all your top teeth, whether through a denture or an all-on-6, which we've discussed before, which is basically 6 implants with crowns, nothing you take on and off. So if you're going to get a denture, a single tooth, or implants in multiple places so you can have crowns on top, your body will think you have teeth, and therefore the bone will not shrink. So even though it's a natural progression to go from this to this, if you have teeth, your body still thinks you have this. Your body still thinks there's teeth and a reason to maintain. So it changes everything. Let's say, for example, in the one tooth scenario, you have a tooth taken out and you don't replace it. Not only does all that shifting happen, that top tooth comes down, the tooth in front leans back, the tooth behind leans forward to kind of create that kind of jam-packed feeling. Not only does that happen, but the bone shrinks. And so if you say, you know what, I had this tooth pulled and I didn't replace it, and 2 years go by, 5 years go by, 10 years go by, the bone is not the same bone you had when you had the tooth originally pulled. That's why I'm such a big fan of replacing teeth immediately. So most cases, if you don't have an infection, let's say your tooth just broke. Your tooth breaks and then we take the tooth out. Most of the time, if you have pretty good bone, I will opt to place the implant on the same day that the tooth is taken out. We call that an immediate implant. So tooth comes out, implant goes in, one surgery. You don't have to wait for it to heal and then you come back for a second time, get numb again, then have the implant case placed. Now, I will tell you this, I have to make that determination with you on your individual circumstance, but that to me is probably the majority of the times that I will do this. But again, it's about bone preservation. It's about keeping that bone nice, healthy, and fat. So when you do want to replace it, you're not dealing with skinny bone that requires more grafting for dental implants. It requires sometimes sinus lifts for dental implants and all kinds of other things that we discuss in other videos. So when we're talking about dental implants, bone is very important. Again, whether it's a full jaw, a single tooth, or a couple teeth in a row. The longer you wait, the bone will naturally shrink because there's no longer teeth there. So let's recap. This is the upper jaw. Teeth, time is passing until the bone gets much thinner and we have a totally different situation. Makes it much more difficult to place a denture, and it makes it much more difficult to have an implant placed, whether it's one tooth or many. Then when we're talking about the lower jaw, again, nice big fat, good jaw, big bone, and little and little, little and little until we have not as much bone. Makes it much more difficult to make a good denture, makes it much more difficult to place a good implant. So time is of the essence. You want to get that tooth replaced as soon as possible. It will require less procedures, less money, because now you will preserve the bone and we don't have to artificially add anything to it. So I hope you guys learned something today about how your jaw shrinks over time and what you can do to prevent jaw shrinking to give you a good fitting denture, and how dental implants can help trick the body into thinking that you still have teeth. If you're interested in dental implants for a denture, a single tooth, or maybe even an implant bridge, please call our office and we can discuss how dental implants can help you in your particular situation and help prevent jaw shrinking.